In today's video, we'll be talking about how to operate a ultrasonic scaler, the Cavitron. So what we're going to need is a Cavitron unit, Cavitron tip, a mirror, and then the suction. Later on in the video, I'll talk about how to not always have to use the mirror so it's a little bit more comfortable for the patient. So the first thing we got to do is turn on the unit, and there's a little switch underneath the Cavitron, and you just flip that on. And what we're going to do, so that we avoid any malfunction of the tip and avoid any friction, we're going to fill up the tube with water by activating the foot pedal. And water will slowly start to fill, and it'll create like a little bubble on top. And we'll just insert the tip. This part gets a little messy. This part can get a little messy, so I like to do it over the tray and just insert the tip, and water kind of goes everywhere, and then just completely push it down and kind of squirts a little bit. All right, so once you get the tip inserted, we kind of just want to make sure that the steady stream is good, and what we're looking for is a fine mist of water and a steady drip. So when you just activate the tip, so that's really a lot of water. So to adjust it, you just use, there's a little water droplet marks, and you just kind of turn it down. Now let's see what that is. So that's kind of what you're looking for. A little fine mist and steady drip. So once you know that the amount of water coming out is the proper amount, you're able to actually work with the patient. There's a few tips to remember whenever you're working with the patient. Make sure that you know to keep the insertion at a 0 to 15 degree angle to make sure that the tip of the actual Cavitron doesn't come into contact with the patient's tooth, because it can make an awful noise and that can actually damage the tooth structure. Another tip is the lateral sides of the tip is the most effective. The back and the front are still effective, but these actually removes the calculus the best. And then another quick fact is just to make sure you're continuously using quick, steady strokes to make sure that the calculus is removed completely. Now that we have the Cavitron all ready to go and activated, and we double check to make sure that the flow of the water is the proper amount, we're going to go ahead and we have the patient lean back, and we're just going to first let them know what's going on and like what we're using. I like to let them know that we're going to be using a water scaler that's going to kind of just have a lot of vibrations and shoot out a lot of water. So we're going to use our suction to help suck it up as we're going. And if they're uncomfortable at any point in time, if they have any sensitivity, just to kind of raise their left hand to let me know, and we can kind of just change things around. But this is going to be the best thing just because it kind of flushes out any bacteria that's in the pockets. It really removes the calculus without putting a lot of pressure on the teeth. So one thing, whenever we're working on the patient, we're going to, this kind of whenever I was telling you about the mirror, not always having to use it so it's a little bit more comfortable for the patient, we're able to actually use the suction to help retract the cheek. So this way it's actually sucking up the water as we're going and retracting the cheek. So what we're going to do is we're going to use two types of styles of techniques as we're working. We're going to use a more of a probe technique. That way, we're going to insert it at a 0 to 15 degree angle. That way we make sure that it's parallel to the tooth. And we're going to use quick, short strokes. That way we ensure that all of the calculus is being removed. So once we actually activate it, it's going to be a lot of water and just quick little strokes. And once we actually go, okay, pause it. So just a quick little reminder, whenever we're working with the probe technique, we're using it on the facials or the buccals of the teeth, and then also the linguals. We're able to use it on the linguals. And the other technique I was telling you about, I'm going to be using it as more of a curette. That way we're keeping it with the lateral sides of the instrument and really getting into the crevices of the tooth on the mesial or even the distal side. Once we're actually done working with the patient, we're going to remove the tip. Let me just slowly remove it. And you don't want to ultrasonic the Cavitron tip, because with all the little metal sheets in there, it would actually kind of start to bend them, and it would cause malfunction of the unit. So just make sure you're taking very good care of the tips. And once you're done with the patient, we want to flush out the actual unit and make sure all the water in the tube is out. So it's called purging. It's actually a setting on the Cavitron unit. So that way it flushes out the water for about 2 minutes. It actually lets you know when. But this way we just make sure we maintain proper maintenance on our Cavitron unit so it's able to be using properly. And once the Cavitron is done being purged, you just turn off the unit, disinfect it, and that is the lesson on using a Cavitron